Did you know that tongue-tie diagnoses are up by 300% this year in the United States? Did you know that 3 million cases of tongue-tie are diagnosed every year? And did you know that 30% of tongue-tie diagnoses are genetic and the other 70% are what we call epigenetic or lifestyle? I want to read to you something that was quoted from a 2018 International Annual Breastfeeding and Lactation Consulting Symposium. An associate professor, Donna Getter, wrote, "Tongue-tie diagnoses are a worldwide reason or words to put to baby not gaining weight, lower removal of milk, or pain with nursing. The rates of frenectomy cutting or laser separation are rising, along with diagnoses. Yet instead of improving breastfeeding rates, it may be causing for early weaning." I'd like to challenge us all to think, is this tongue tie, is this lip tie, is it really a tethered oral issue, or is it more a midline or a nervous system issue? So let me explain. 70% of those people, like I was saying, are having an epigenetic factor, meaning their lifestyle is what is causing these tethered oral restrictions or tongue tie. And so what does that even mean? When does that start? Well, the reason that I'm doing these videos is to urge moms to try and pay attention to things even before conception, preconception. A lot of lifestyle things that happen during preconception, conception, and even pregnancy are what is compounding and cascading into these kiddos' nervous systems. So what does that look like? So physical stress, chemical stress, and emotional stress. These are all the reasons why we have stress on our nervous system. So preconception stress in the chemical realm could look like some sort of vitamin supplement, medication. It could be a poor diet. It could be even listening to a doctor or physician's recommendation to increase your B9 or your folic acid. They always recommend that you increase that quite a bit to try and avoid neural tube defects like spina bifida. But what they aren't telling you is that it might actually be causing interference in your biochemical pathways that help you create and sustain a healthy pregnancy, and could actually be causing a lot of these tethered oral tissues or restrictions in mouths. And that could be lip tie or tongue tie that I'm talking about here. So we are given this sometimes poor recommendations for supplementation, or we're taking poor quality supplementation before, during, and after pregnancy, as well as poor diet, as well as emotional stress. Most people don't touch on that piece, and that's the big scary piece that a lot of people don't talk about. But there are a lot of emotions that go with preconception. Unfortunately, there is a lot of infertility or miscarriages in the world today, and that's a huge emotional piece, as well as if there are any miscarriages beforehand, as well as any emotional stress between the partner and the mother, as well as any emotional stress about a parent, all those kinds of emotions that come along with it, as well as physical stress. So these babies are in mama's belly for 9 months, and if mom's pelvis is out of alignment or shifted or torqued, it creates what we call in utero constraint. That basically means a lot of twisting and turning and stuckness for a baby. They can't freely move in the fluid like they should be, which sometimes means their neurology isn't developing as well as it should be. And it sometimes means that they have a lot of stress physically because they can't move around as well. So these physical, chemical, and emotional things are what cause stress on the nervous system. And the last physical stress that happens before baby's born is the birthing process. So labor and delivery can look like all sorts of things for all sorts of people, but the bottom line is it's stressful on mom and baby. Even though it can be beautiful, that stress that is created in the birth canal, the pressure that gets put around babies, those contractions or those surges, that's stressful on their nervous systems, as well as if there's any kind of stuckness with their shoulder in the birth canal, that puts a lot of additional physical stress on them. And then they're finally birthed through the canal. And if they are birthed through the canal, there's about 90 pounds of pressure that gets put on this brain stem or this nervous system right here. And that part right there is the most crucial. It's called your Houston control because it literally controls every coordinated movement, thought, taste, smell, everything that your body does. So we have this nervous system that gets put stress on it, and doctors are pulling babies' heads out with about 90 pounds of pressure in a vaginal delivery. Now let's talk in a delivery that involves more intervention like forceps, C-section, or vacuum. Those are going to be upwards of 120 pounds of pressure put right on this delicate little brainstem right here. And like we talked about, it's that Houston control for their whole entire body. So not only is that putting stress on their brainstem, on their body, on their nervous system, it's also causing for their body or their body to be stuck or misalign over here like this. So to give you your bearings here, this is the baby's back of their skull. This is the baby's neck, and all these little yellow guys here are nervous system tissue. This is the brainstem, and these are nerves that come out of every level here. So those physical, chemical, emotional stressors that babies endure, then the birthing process then puts the final straw and misaligns the spine. So those things happen. Baby's spine misaligns like this. And as we're talking about tongue tie today, when that spine misaligns, you can tell, I'm exaggerating, but you can tell if they're misaligned over here, they're going to be stuck this way. So they're going to have an easier time nursing on one side versus trying to go against that. It's going to be a lot more challenging for them. They might writhe in pain, they might complain, they might not even latch at all on that side. You might have differences in flow on one side versus the other because they're having to go against all that stress that's happening right up here in the brainstem and in the nervous system. So those things happen, and then what happens is our body starts to present symptoms. So symptoms could be, like I was talking, immobility to fully move your neck. Symptoms of tongue tie can also be not fully eliminating milk, painful latch for one side or the other on mom or both, not getting them to fully latch at all, or gasping a lot of air while they're doing it, or making a lot of clicking weird noises. Those are all symptoms that there's something happening with their latch, whether it's a diagnosed tongue tie or not. There's some sort of challenges with the latch going on. And these misalignments on the spine and the nervous system are the exact reason why your baby is having challenges with latching, maybe have a tongue tie diagnosis already, maybe even had a revision and it's not helping. Maybe they have reflux, maybe they have colic, maybe they have digestive challenges, maybe they have just uncomfortable in their body. They just don't ever fully relax, or they're kind of on edge. All those symptoms are ways that baby's body gives them a clue, or gives parents a clue to say, hey, something's going on here. Something's not right with the nervous system. And it is my mission as your pediatric chiropractor to let you know that these symptoms aren't something that babies just grow out of. Unfortunately, they just become more severe and more significant symptoms in the future. And so it's my mission to start with these kiddos as they're being born, or even preconception or conception, because as we can start at this stage, we can prevent a lot of these crazy diagnoses that families are having to endure right now. Autism, ADHD, sensory processing. 1 in 5 kids are diagnosed with a mental illness disorder right now in the United States. And those are statistics that I'm not okay with. So I am really trying to encourage families to get their baby's nervous systems checked, not only to help with their latch challenges, but to help prevent a lot of these scary things that could happen with the nervous system not getting checked or corrected in the future. So what I'm doing is I'm doing these videos to say, hey, share this with your friend, share this with your sister, share this with your coworker who has a baby who's not latching, or who had a stressful traumatic birth, or isn't crawling, or isn't walking, or has digestive problems, because it's all tied back to the nervous system. And so what we're doing is we're offering these videos for you guys to share with those people that you know and love, and that they can hopefully try and prevent a lot of that cascade of events like I was talking about. So we have had the privilege of serving hundreds of these families who either have a tongue tie diagnosis, or don't, or have just some sort of latching challenge. And whether they're doing an intervention, like a surgical intervention, or they're wanting to try and do chiropractic first, chiropractic is always important before, during, and after an intervention like the tongue tie revision. Oftentimes, preparing the body and calming the nervous system down before the surgery is really beneficial for baby's healing. Getting their body balanced, getting their muscle movement balanced after correcting a lot of the misalignments that happen to baby, then can cause for the muscles to be moving even, and that is going to help when they do get a tongue tie revision, help things heal more evenly, help them be able to move their head and neck and their range of motion easier, as well as heal their nervous system and allow for their nervous system and their muscles to have a more balanced control of things, which is going to help them as they continue to grow and develop new milestones in the future. So whether you're planning on doing the revision or not, chiropractic is the first avenue for sure. And I'm not just saying that because I am a chiropractor, you guys. It really is truly the root of a lot of these things that are happening with kids. And if we can just check their nervous systems to see how we can help, an adjustment on a newborn, has our pinky like this, and there's just a light sustained contact. It's using the amount of pressure you would check a fruit for ripeness. That's how our pressure is for an adjustment. Nothing big, nothing scary, no twisting, no popping, no cracking. Newborns have very little stress in their bodies right now, and the stress that they do have, we want to help them unwind it. And so we were looking through their nervous system and their spine, using that pressure I was mentioning with our pinkies, seeing where we can help unwind a lot of that stress. And a lot of it is, like I was mentioning, right up here and right in the skull here. So we do some gentle balancing, and babies generally sleep right through it or really enjoy it. And it's such an awesome, rewarding experience for me, because I can see babies' lights turn on. I can see their eyes light up, and I can see them just say thank you without having the words. And my mission is to try and help these parents who are having struggles with this latch, because that could mean going to formula when that wasn't a part of your goal. Or it could mean having all this pain and emotions that come up with thinking this was going to be such an easy, blissful, beautiful thing you can do for your baby. Or parents who maybe not had the support before they got to our office, as far as continuing to try nursing and latching in different scenarios that you can change and help. And we want to encourage them that they're doing exactly what they're supposed to be doing in the right time that they're supposed to be doing it. And we'll just come alongside them and help them with that. If you want us to come alongside you and help you with your nursing story and your nursing challenge, and whether that means that you've switched to pumping already, it does not matter. Your baby still needs their nervous system checked. So we want to help you wherever you're at. We are offering, for anyone who is local here to Rochester, New York, a $20 exam if you request an appointment on our website. That's www.treeofliferock.com. Sorry, I blanked. And in the corner, there's a request an appointment tab, and make sure you mention that you saw the tongue tie talk and got the $20 exam, and we'll hook you up from there. But we really want to help you guys. Please share this video with your coworkers, your friends, your sisters, your cousins, anyone you know who has a baby who has a nervous system. We can help. But literally, share this tongue tie talk with them if that's something they're struggling. And I hope you guys have a blessed afternoon. My name is Dr. Chelsea Moe with Tree of Life Chiropractic, and I enjoy getting to know all of you guys here in the Rochester area coming up soon. Bye, guys.